The most enjoyable part of my profession, which is extremely rewarding, is I'm able to help patients as a whole. So I'm able to help a person, not like just a patient addressing their acute issue and that's it. So I'm able to help them as a whole. So patients come for their a lot of problems because we are the primary care. So it's really rewarding how they're looking for help and they often have not a lot of clue where to go, and I'm able to provide the resources, assistance, advice. I often have patients which come like the whole family, so husband, wife, kids also, because I take care of kids as well. So the whole family come to me as I'm their primary care physician. So knowing the whole family unit and treating it accordingly, helping them is extremely rewarding. And every time I do it, and I'm like, I reaffirm myself that that's why I'm a physician, that's why I'm in the field, because that's what I wanted always.
Welcome back, YouTube. Today we'll be talking about who primary care physicians are and what they do. We are joined by Dr. Asiya, who's a family medicine and primary care physician in Santa Clara, and we will discuss with her what her journey was like and what she does. It's going to be exciting, so stay tuned. Welcome, Dr. Asiya. How are you today?
I'm good. Thank you so much for having me here.
Yep. So how about we start with you introducing yourself, what you do, and who you are?
So my name is Asiya Khan. I'm a primary care physician. I got trained in family medicine from one of the program in Central Valley, California. It's near Stockton. I'm a graduate from Pakistan, graduated in Sindh Medical College, which is in Karachi, the southern part of Pakistan. And after that, I came here, give my USMLE exams, which is a requirement, and then while giving the exam, did some research and got the residency. And was lucky to get it in California, which is pretty challenging. And after that, since I have been practicing.
Okay. Uh, so you said you did it from Pakistan first. So you got your education from Pakistan and then came here. Um, how would you say that's a bit different than people who do it over here?
So I would say because the system is different, the way of education is a little different. The matter is the same because, of course, it's medicine, it's human body. In Pakistan, it comprises on 5 years. Here, it comprises a little longer. Like medical school is 4 year, but before this undergrad for 4 years, so it's a little longer. But in Pakistan, it works in different patterns. So you do it in 5 years. So 2 years of first 3 years of academic, and then in third year you start transitioning in rotations as well, and then you continue in last 2 years as well.
Okay. So, how about let's jump right into it. Can you explain your profession and what you do, in a bit more detail?
So I got trained in family medicine, and family medicine gets trained resident in most of the fields of primary care, which include the clinical work and then OBGYN work, surgery, medicine, ICU, and then the specialties in the last years of residency. This is with the idea like we can practice primary care, but if you want to develop some expertise and want to work with other specialties or OBGYN, we can pursue that. So most of the family physician work as primary care because of the better work and work family life balance. Many go to OBGYN practice as well. Many go to sports medicines as well, and
Mm,
few then do some specialty work like dermatology or start working with rheumatologists. So they have the option to get some training, some experience in those fields, and they can work there. But most of them work in primary care. I work as primary care. I am a mom. I have kids, so that's why primary care works best for my work and family life balance. I work in a clinic in Santa Clara, and provide the whole scope of primary care, which include preventive care, acute care, urgent care, and I work with integrated team of health coaches, dietitians, physical therapy, mental health, because the whole team works really well and supplement primary care. So I work with the whole team. My practice is mainly for tech employees and their family because I'm based in Silicon Valley. So a lot of people from these tech companies like Meta, LinkedIn, uh, Intuit, Nvidia, and the list goes on.
Yeah, yeah. You're talking about OBGYN. Can you explain what that is?
So OBGYN is obstetrician and gynecology. So basically women health. Many can practice as an outpatient providing women care practices. Mm,
Oh,
some can do inpatient as well. So delivering babies, assisting in C-sections. So the whole prenatal care, basically pregnancy, delivery, and everything.
yep. Oh, okay, okay, okay.
Yeah.
Um, so you're talking about how like primary care helps you with like being a mom. So how is the workload as a primary care physician?
So the workload is in any field, the workload is there. So we cannot just say, okay, this is such a chill one, like you don't have to work. I mean, you have to work hard in any field. That's what I would say. In this primary care, as I mean, from work family life balance, is like I have a set timing, 8 to 5. So I don't take after weekend after work calls, or I don't have to go to the hospital because some physicians have to go to the hospital, rotate. Some are on call, so they have to be in emergency because they can be called for admissions and stuff like that. But in this, I have a set schedule of 8 to 5 because kids are in school. I have to arrange pickup, drop off, whatever. So that works better for me. But it is busy. So every profession, every job comes with its own requirements. So yes, as the system we practice in United States, like everything goes through primary care. So even though the patient goes to specialty, they have to go through primary care, and in the end everyone say, okay, follow back with your primary care, follow back with your primary care. So we have to coordinate the care with different specialties which the patient has been seen, and then treat the patient as a whole. And we cannot just say, okay, if you go there, you're done, I'm done with you, I don't need to follow up. They will be coming back to me because I'm providing the whole primary care, including preventive care and the acute issue they're dealing. So there is a lot of follow-ups involved. And as we live in tech industry, we have a lot of emails, messages involved. So it's constantly, you have to be paying attention and doing these things. I mean, responding patients on time. We have a policy like we respond patient within 2 hours instead of rather than other practices, which might say 24 to 48 hours. So you have to do your due diligence and being prompt at work. So there's a workload, but it is manageable, but it is busy. Uh,
Okay.
so that's what my practice is.
Okay. Yeah, so you said your day is from 8 to 5. So what does your normal day look like? Can you go through that?
So in the morning, when we start our day, it's like a team huddle, which means like the whole team get together. They discuss, okay, what's going to be the workflow, what's the issue, no issue, any patient discussion that lasts like 30 minutes. So the whole team meet, discuss what if there's any issue, and after that we start having patients. My practice involve appointments and messaging as well. So depending on what's the schedule, I might have patients schedule starting from 8:30 till 4:30. Appointments are usually 30 minutes, so could be back-to-back patients. Can get usually get break in between to respond to email messages. So that kind of in between. So like an appointment and then a message time, then appointments. So that's how it goes. But usually appointments are 30 minutes.
Okay. Um, so let's jump into another side of your profession. What is the most enjoyable part of your profession?
So the most enjoyable part of my profession, which is extremely rewarding, is I'm able to help patients as a whole. So I'm able to help a person, not like just a patient addressing their acute issue and that's it. So I'm able to help them as a whole. So the So patients come for their a lot of problem because we are the primary care. So it's really rewarding how they are looking for help, and they often have not a lot of clue where to go, and I'm able to provide the resources, assistance, advice. I often have patients which come like the whole family, so pair, husband, wife, kids also, because I take care of kids as well. So the whole family come to me as I'm their primary care physician. So knowing the whole family unit and treating it accordingly, helping them is extremely rewarding. And every time I do it, and I'm like, I reaffirm myself that that's why I'm a physician, that's why I'm in the field, because that's what I wanted always.
Okay, okay. So, also, what is your like? What is the most common thing you see with patients?
Pain. Everyone is
Oh, okay.
hurting from computer work, so they're always on computer. Most of the time they're on phone, so pain here, hand pain, and back pains.
Oh, okay, okay. So, what do you do for that?
So for that, basically, they will like usually to get a quick fix, which is not a quick fix there because it's a long-term recovery. So we recommend some stretching exercises, recommend a lifestyle where they have a break between their work, because when you're on computer or on your tablet or phone, you just want to be on it 24/7 maybe.
Yeah,
So but it's good to have a break because our body needs a break, our body needs some flexibility. So I give them a program where they can incorporate those breaks, exercises with it. Also recommend routine exercise, which is very important to build up our muscles, to strengthen our muscles, that we often forget, especially working in tech industry. So that's something we guide them, recommend them, and then we can connect with them to physical therapists who then provide the whole structure how they can do.
that's amazing. What would you say is the most memorable experience of your whole career? You can talk about even your education too, if you'd like.
So I would say I had quite often memorable experience because I interact with a lot of people and they come from different background, and I have seen how they've come so helpless, just frustrated with what they need. And when I'm able to provide that, they just like the joy, the happiness I see on their face is just amazing. So I used to work, I got trained in residency program in Central Valley, which is a pretty underserved area. So I did have patients like mom and dad coming from different background, coming from South Asian background as well. And they really get happy to see someone from their background. I've seen patients like, just bringing things for me. I remember a patient was so happy that he brought the whole ice cream sandwich box for me, which I was able to treat my nurses and medical assistant as an ice cream a party at that time.
Yeah,
So that was so rewarding that I was able to do something which is actually my job only, but it just made a huge difference in someone's
yeah,
life, and
yeah,
that's how they want to uh, you know, uh, say thank you, and
yeah,
ended up as a treat for the whole clinic. So why not?
yeah, yeah. No doubt your profession is very impactful on other people. Um, but does your job also does being a primary physician come with like stress? Is there a lot of stress?
Yes, there's stress. I don't know if you've been hearing. I mean, you're in high school, I believe,
Yeah,
but there've been talks of physician burnout because many. I mean, there's supply and demand issues as well. A lot, especially with this COVID thing. Things change a lot. So there's a lot of burden, stress on primary care physicians as well, and generally in the medicine field. There's a lot of insurance requirement, which is kind of an admin work. But of course, it works parallel, it goes parallel with our clinical work. So patient care can be easy, but those admin work is like an added burden on physicians, and it is stressful. So we just want to make sure that uh, like we send insurance the right information so that usually insurance send back to us, hey, this is not correct, this is not. I mean, you don't have time for all these things, so you want to
Yeah.
do it right the first time. But there are back and forth communications from the insurances, and then there are back and forth communications from patients as well, because if they're not getting anything from them, they don't know where to go, so they come through us. So there is uh, uh, stress involved, and which we want to make sure that we have the resources available to address those concerns, and of course the manpower as well.
Mhm. Okay. Okay, so that's interesting. I didn't even think about insurance, if that would even be a problem in the medical field, especially with like clinical doctors like you. Um, do you have any advice for me and my viewers, my fellow high schoolers who are planning to go into your field? Yeah,
Sure. I do see it's a common concept that, oh, if you go in medicine field, it's a long journey, and then you'll be working for the rest of your life like crazy. I mean, any education, people have to work hard, and then once we start working, nothing is like a, if you work hard, you can get reward. There's no learning without working hard. So I would say, if not medicine, if you go to other industry, you will be working there as well. I mean, you have to work hard, and the rest of your life you want to do it. And if you don't do it, it's kind of, you don't have any uh, motivation then. So
yeah,
that's kind of frustrating for people.
mhm,
Yes, medicine journey is a little longer as compared to other journey, like if you go to engineering or business or anything, but it's very rewarding. So, for example, it does take 8 years after high school, plus minus couple of years for the MCAT and application process and stuff. So maybe 10 years. But once you're in, it is extremely rewarding. So don't be scared of that long journey, which you hear from people. Just stay committed. You're young, you guys can do it. Sky is the limit. So there's no reason that we get afraid and step back because, hey, it's like 8 or 10 years.
yeah.
Just keep reminding yourself that you can do it. Believe on yourself.
Uh-huh.
Keep reminding that you got this, you can do it. If you did high school, I would say you can do anything, I believe. So just keep reminding yourself and have a belief
Uh-huh.
in yourself. And this is
Yeah,
extremely rewarding.
yeah,
So look at the
yeah, yeah.
big picture, I would say.
Yeah, I definitely agree. So a lot of high schoolers, when they're looking at professions, where they want to go, what they want to do later in life, first thing they look at is money. How much will I be making? So how much do primary physicians make
So,
generally?
so yeah, there's good money involved in being a physician. Generally in California, I can talk about, it can range from 186 to 259 thousand, I mean K, to 9K
Yeah,
dollars. Uh, this is California, and it's for a full-time employee. So people can opt to do part-time, and it might be a little lesser, but so this is a decent amount. If you go for specialty practice or inpatient, might be higher, but then it comes with added workload as
yeah,
well. So it is pretty decent. You just have to remember that yes, it's a long journey, so people do accumulate some student loan for 4 years of undergrad and 4 years of uh, medical schools, and then yes, they have to pay it while they're earning. So this something like, of course, stressful and often kind of discourage some people as it's a long student loan.
yeah.
But there are options, like many clinics, many hospital systems provide student loan option with some contract. You can work in suburb areas, get some waiver, working there for a few years, and there are assistance available. But yeah, salary is pretty decent, I would say.
Okay, okay. Um, I think that's about it. Is there anything else you would like to add on?
Uh, I think this is such a respectful and rewarding profession that uh, high schoolers should consider. And it is with the advancing technology, healthcare is getting uh, a lot of those options as well, like physicians are practicing clinically and then getting involved in technology as well, because technology runs side by side for the medicine as we need new tools, especially tools for remote care, as many people might be in remote areas and they don't have access to all the care within US and globally. So that's something technology is playing an important part as well. So there's a lot of opportunity when you take medicine. You can work as a physician, you can do a private practice, inpatient, go into technology like healthcare technology. So opportunities are unlimited. So
Yeah.
that's why it is a good option to consider. And we need good doctors. So yes, please consider this field. And I'm pretty sure you all can do it, because uh, our young generation is very resilient and they can be dedicated.
Yeah, as you say, the sky is the limit. Yeah, well, thank you for being here, Dr. Asya. It was an honor to have you here on my YouTube channel. Uh, Thank you and bye-bye.
You're welcome. It's a pleasure to be here. Take care. All the best.